everyone, and welcome to Vital Wisdom with me, Dr. Eli Camp. I'm so glad you could be here today. We're going to talk about vitalism because I'm a vitalist, and it's really important to understand what that is and how that makes me a different kind of practitioner than other types of practitioners. And there are other vitalists out there. I'm not the only one, but that's what we're going to talk about today. So, vitalism is a way of approaching medicine where we recognize biological, chemical, physical forces at work. And I think all doctors, all healers would agree that that's a component of health, right? You have chemical processes in the body, you have physical stuff, we have form, our skeleton, our muscles, all of these things. But a vitalist recognizes, so in vitalism, a practitioner of vitalism is called a vitalist, and a vitalist recognizes an additional component, and that's an energetic component. That which animates us and makes us different from a rock, which also has chemical and physical properties. Or a car, which has all these different pieces and parts, but we don't consider those living organisms. And we really take it a step beyond the parts, right? We are much more than just an accumulation of parts. There's something that connects it all together that makes us go, that spark of life. This is the major component that makes a doctor or any other kind of health practitioner a vitalist. In Ayurvedic medicine, they call this life force prana. In Asian medicine, they call it chi. And in naturopathic medicine, we know it as the vis, V-I-S, or the vital force. And together, we recognize the chemical, the physical, and the energetic force all work together to drive normal and healthy function in a body. And so when something goes wrong with any of those elements of creating optimal health, they have to be addressed, and this includes the vital force. We really do think of the body as a living organism rather than a machine with replaceable parts. Does that mean that we would never say, hey, you need a heart transplant or a liver transplant or a kidney or a hip replaced? Well, at some point, the body can be degraded so much that the only chance you have to continue on in life is to have some type of part replaced. I acknowledge that. I've treated a lot of people who have had parts replaced. But it doesn't mean that when you replace that part, everything's fine. You've got to think about what happened in that organism that led up to that particular part not working anymore and needing to be replaced or needing some other kind of surgery on it. Something happened. How do I know that? And that's because we have the ability to heal ourselves. Our body heals itself. In fact, the innate intelligence within us guides our body to try and be in its healthiest state every second of every day. When we do not do the things that allow our body to heal itself, or when we do things that prevent our body from healing itself, we become imbalanced. The vital force, the vis, that energetic component of who we are, becomes imbalanced. And we start to see symptoms on the physical plane, in the joints, in the organs, in the way we think, in the way we move, things like that, right? So in vitalism, we not only recognize that there's this energetic component, we engage this intelligence by the way we practice, which I'm going to talk a lot about, to speed recovery from injury, from illness, and to build our optimal levels of health. Now, when one looks at nature, you can see that there is an inherent capacity for healing in trees, in other plants, in animals, and any system that's alive. Wounds heal, fractures mend, new growth appears, even if we do nothing. This is the evident self-healing capacity of the body. This is a law of nature. It's a principle of naturopathic medicine, and we call it the vis medicatrix naturae, the healing power of nature. It's how we were created. It's how we were built. It's how we're here after thousands and thousands and thousands of years, or however long you believe humans have been on the planet. I don't want to get into that philosophical debate at the moment. We might do that later. But it left to its own devices, our body is going to strive to be its healthiest at any moment and uses what it has, what is present, in order to do that. As a naturopathic doctor, as a vitalist naturopathic doctor, it's always my goal to support that built-in healing ability of the body. We have a lot of resources that we can draw on. There's also a way that we can sort of ask ourselves, how vital am I? So when your vis, your vital force, is balanced and you're giving your body what it needs and you're not poisoning it, and you've supported that innate healing within a body, it's clear and it's evident. Every single person that walks into my office, I can tell if their vis is strong, if their vitality is present, if their vital force is intact and just needs a little bit of help. The body just needs a little bit of fine-tuning. Well, how do we know that? Well, the eyes are bright, the skin is clear, it's got a good color to it, our hair and our nails are strong, they're not brittle, they're not breaking, they're not thin, our muscles are toned. We have energy. We wake up refreshed, we go all day. Maybe as we get older into our third age, we might need to take a nap, that's okay. We sleep well. We lay down to go to sleep and we sleep all night. We have good, strong digestion, which means we are able to break our food down and get at the elements within the food that we need to thrive so we can absorb our nutrition. We have a bowel movement every day, sometimes two. And emotionally, we are secure within ourselves. We have a sense of being loved. We have a stable, predominantly positive mood. These are all examples of a strong vis. When a person is sick, when the body is not as healthy as it could or should be, these characteristics are not present. People are in pain, they're not sleeping well, their memory is not working like it should, their skin has a poor complexion, the eyes are kind of dull. Like, it is very obvious to someone who can recognize a healthy human with a strong vital force and a human who does not have that present. So you might be wondering, because there's functional doctors and lifestyle medicine doctors, and you might be wondering, well, how is vitalism different from what these doctors talk about? And it's a fair question. So, how are we different? Well, it should be relatively obvious, and if not, I'll point it out to you, how we're different from mainstream allopathic medicine. We do not take symptoms and prescribe a drug that hides those symptoms by creating another disease state, and that is what most pharmaceuticals do. You may enjoy relief from certain symptoms when you take a prescription drug, but because of the way allopathy works, you are actually creating a secondary disease state, and we call these side effects. Think about that for a minute. The first complaint that you might have, you get a prescription for, and then you get these other complaints that come along with it, even though the first complaint might seem better. This is not vitalism. This is not nature cure. And I know that's a new term. I just threw that in there. Nature cure is a very old form of naturopathic medicine. in which they did not use pharmacy, they didn't inject anything, they didn't do any type of suppressive medicine. Everything they did, and which has carried forward into the vitalist naturopathic approach, was to give the body what it needs and to remove things that are poisoning it, to make sure the blood and the lymph are clean and moving, all sorts of things that go into creating a healthy human, and stimulating, working with the body's wisdom, stimulating that vital force to encourage the body to self-heal, which it does really well. So back to, I got a little sidetracked there, back to how we're different. So other forms of medicine, in other forms of medicine, practitioners are trained to see a set of symptoms like high blood pressure and maybe some imaging that shows the heart is a little enlarged. And they're trained to take symptoms. It could be anything, right? I said the heart, but it could be a headache. It could be joint pain. It could be insomnia. And they give it a diagnosis, and then there's a drug that has been developed and approved by a body of professionals that should be used to treat that diagnosis and those particular symptoms. Okay, that's one way to do it, but I don't do it that way. As a vitalist, as a nature cure practitioner, as a naturopathic doctor, that's not my job, and I did not go into medicine to do that. I went into medicine to instead ask the question, well, what's going on with that person's heart? Or what is happening within that person that we see hypertension, elevated blood pressure? What's going on that leads that person to suffer from migraine headaches or joint pain or any of the hundreds upon hundreds of diagnoses that exist today? That question, when we answer that question, we start to understand what it is that that particular body needs to regain its health, because symptoms are simply a sign that something is wrong at a deeper level. Something is not working. The body is missing something, or it has too much of something. There's toxicity, or there is poor absorption. I mean, there's so many things that it can be. And when that's corrected, whatever that underlying cause is, then the body no longer needs to produce symptoms of illness. The blood pressure can normalize. The headaches can go away. Those are the body's way of telling us, hey, something's wrong here. Well, that's the job of the vitalist, is to figure out, well, what is going on? Why is this body not operating at its best? We're going to talk a lot more about this in coming shows and take this apart piece by piece. My goal today is really to get you to understand this approach to medicine, this philosophical belief that we cannot take individual pieces and parts of the body and treat them and expect that the organism as a whole has become healthier, right? You cannot poison a body back to health. And I believe, with a few exceptions, pharmaceutical drugs are poison. And that maybe you want to shut this off right now, because maybe you're on a bunch of pharmaceuticals. But I bet deep down what you always tell yourself is, I don't want to take these drugs anymore. I don't feel my best. I don't feel better in all ways. I don't feel like my body's healing, right? Who wants to be on a handful of pills every day for the rest of their life? Now, I did say with a few exceptions. So the most obvious one to me is type 1 diabetes, right? Without insulin, which is a pharmaceutical, people with type 1 diabetes die, which is why when I hear stories about holistic practitioners taking people off their insulin when they have type 1 diabetes, I cringe. I'm like, what are they doing? That they do not understand medicine, right? So I believe that insulin was a life-saving drug. And it, unless we can figure out how to fix the pancreas in humans, where the organ has stopped working and stopped producing insulin, until we can figure out how to do that, insulin is a life-saving substance. Another example I could give you is thyroid. So sometimes people's thyroid, which is right here in the neck, right, and it produces thyroid hormone, and every cell in the body uses thyroid hormone, and without thyroid hormone, the same thing happens as when you have type 1 diabetes and no insulin, you die. So thyroid hormone, when it is needed to replace thyroid hormone that's not being made in the body, I think that's a life-saving drug. And there's a few others. Those are the two most obvious that come right to mind. And I won't even go into, at this point in time, all the drugs that are absolutely unnecessary, because as you join me each week, I'm going to talk about that stuff. I want to stay on track with vitalism. So, how is it different? It's different because different than other forms of medicine. We believe in the energetic force that underlies everything and makes us go. It makes us animate. We don't believe in treating the different pieces and parts. We treat the whole organism. We understand we're self-healing. We give the body what it needs to get out what's poisoning it. We make sure it's not toxic. We make sure all of the systems of the body are flowing and doing well. And we support and stimulate that vital force within us, which underlies that self-healing capacity within a human. What we see happening today is a resurgence of vitalism, even if they're not calling it that. It's an older concept than mainstream medicine. Healers from ages ago, eons ago, recognized that humans were the same as all the other living creatures around them. And you can tell from oral tradition and the early writings and even pictures on cave walls that they understood that you had to make the organism whole again. You didn't just chop something off, right? Unless, of course, you've got someone with gangrene and you don't have a good old-fashioned nature cure doctor around who could potentially treat it. You might have to amputate. I mean, there are reasons to work within mainstream medicine. But I think people have started to realize that they are a commodity. This is going to be a little controversial, but it's my truth. And it's why I walk further and further away from allopathic medicine every day. And that is, what business, because do not doubt for a minute that the pharmaceutical industry is a business and they're there to make money. What business would get you to the point where you no longer need to buy their product? Now, think about that. Why would a car manufacturer make a car that never needs to be replaced? They would go out of business. It's true in all industries. Nobody is going to put themselves out of business. And as I've practiced medicine and I've grown older and I've been on the planet a long time and I have read studies and research and opinions and met people, right, who are part of these different industries, I've realized that this is not a conspiracy. This is a truth. Now, your everyday person who works in a pharmaceutical company or developing a drug, they believe they're doing a really good thing. And in some cases, they are doing a really good thing, right? I just mentioned a few exceptions just a minute ago. But when you approach the body with this allopathic or reductionistic ideology that you have a part and that part needs to have action on it, then you've missed the idea that we are a whole entity and that we're trying, every day our body's trying to be its healthiest in self-repair. But if you did that, the person wouldn't need a drug. You don't really need most of the drugs anyway, but on a superficial level, there would be no symptoms to prescribe that drug on. We wouldn't need it. And what would happen? Most of them would go out of business. So as I've recognized that humans across the globe are being used as a way for different companies to make money, and I take that, and in the bag I put, right, my understanding of the human body and the way I practice medicine, and I see other people starting to realize this, it makes sense that there's a resurgence of this vitalistic approach, holistic. Now, there are a number of practitioners who were allopathic at one point, trained in mainstream medicine, ready with the script pad that they would just carry in their pocket, you know, buying into these thousands of diagnoses, who had a realization or some, you know, they went to some class or they met a practitioner or a patient, and they opened this little door in their mind which said, you know, there's something else. There is another way to practice medicine. A lot of times what you'll hear, see, read is that vitalism doesn't have any scientific backing, and that couldn't be further from the truth. It may not be published in mainstream publications, but, you know, that's a whole rabbit hole of who owns those journals, who pays for the research that gets published in those journals. Because if you go looking at the journals which do not have pharmaceutical companies funding the work, you get a whole other story. There's a lot of science behind nutrition and eating the right foods and taking in the right nutrients. There's a lot of research behind detoxification of the body and how it works better when you get toxins out. Even more research about the use of water in hydrotherapy on the body. There's even evidence, I'm going to say this word, for the homeopathic modality of healing. Lots and lots of research and evidence. So the science is there. It's just not jumping out from the mainstream journals, which are in large part funded by the pharmaceutical companies. So people are realizing a number of things. One, that the science they're reading is not the only science, that once you get started on pharmaceuticals, not only is it rare to be taken off, but over time you continue to get a prescription for something different because you have to deal with the side effects of the first one. Now you have two. And not only do you have the side effects from two drugs, you have side effects from two drugs that are acting synergistically. So you really have three things. You add a third one. And let me tell you, when they do clinical trials, they do it on the individual drug itself. They don't do it on a combination, on this soup of pharmaceuticals that people are on. They don't do that. And folks are becoming wiser. They can notice for themselves, they can understand for themselves that their body is healing itself when it's given the opportunity. And you have a lot of very smart, well-educated, well-experienced, life-savvy, street smart people who are saying, hey, wait a minute, that over there does not make sense. Why would you give me a drug for that when this group of people over here is saying, if I maybe, get a food allergy test and take an offending food out, or I drink more water with minerals in it, or I eat different kinds of food, well, this problem that I have it goes away. Why can't we do that? Why do I have to take a pill? And as people are realizing this, they are being drawn towards this more vitalistic approach or holistic approach. So I started to say just a minute ago that there are practitioners whose this door is opening in their mind, and we have this surge of doctors calling themselves functional doctors or lifestyle medicine doctors. Well, this is not new. They've coined a term to make a vitalistic approach to health their own. But vitalism predates all of that, right? All of it. Nature Cure is based on vitalism. And that is older than mainstream medicine by many, many, many hundreds, if not thousands of years. I'm going to switch gears just for a minute. If you have questions about vitalism or the vitalistic approach or any of that, you can always shoot me an email or comment on whatever platform you're seeing this episode on or listening to this on, and I'll clear it up for you. I want to go back to this idea of the body's innate intelligence, its natural healing. How does that work? How does that factor into healing and recovery? Well, we don't necessarily understand how the body knows when there's been, let's say, a wound to the arm. Let's say you cut yourself with a knife. This intelligence that is within our body, the vital force, the ability of ourselves to self-heal, kicks into gear. Now, can we trace this using cell biology and biochemistry? And we can say what the body's doing, but we don't necessarily know that trigger. Now, people will say, sure, there's cell signaling. You get a cut and all of a sudden you have this cascade of molecules and that causes the body to react to that cut. Okay, that's after the fact. How does the body know to self-heal? Well, you can't answer that. I don't think there's anyone on the planet that can answer that. It's how we were built. It's how a living organism is put together. It is the law of nature for a system to heal itself. And as I've mentioned a few times, certain things have to be in place and certain things need to be removed. We need to make sure that the body's thriving. Just take a tree. We know that a tree needs light and water, and it needs organisms in the soil. It needs the right temperatures. And when those things are present, that tree grows and it thrives. If it doesn't have the food that it needs, or it doesn't have enough light, or it doesn't have enough water, the tree does not thrive. It may live for a while, stumble along, but it doesn't thrive. And humans are no different from any other living thing on the planet. Now, it's not just about the food we eat, the water we drink, the physical work we do with our body. We know this as exercise. The sleep that we get, the love of our community. It's not just about the functioning of our GI tract, because digestive health is a cornerstone of making sure the body can self-heal and can do what it needs to do. We'll have a whole episode about the digestive health. It is also about the genetics, right? You were born with a set of genes, and those genes can be modified by your environment, by how you're raised, how you think, your emotions, the chemicals in your body, and the environment. So if you live in a place where the air is poison, where the soil is deficient in minerals, where the water is toxic and you don't filter it out, where you potentially have too much noise in the environment, or the light is not good. So you have products in your house or in your car or in your workplace that you work with that are toxic. We think of all of these things as the environment. Mold being present, poor quality of the air, like all of these things. This environmental soup really has an effect on us just as much as what we do, what we eat or don't eat, or drink or don't drink, or sleep or don't sleep. So we only can control a certain part of it. And then you have what is around you in your environment. And these come together to affect and influence health outcomes. I would no sooner walk away from viewing the body as a whole with its energetics and its physical properties and its chemical properties. Once you know, you know. Once you've seen something, you can't unsee it. You can't unknow it. And I've worked with thousands of patients who have been through the gamut, like of healthcare and operations and drugs and all sorts of things. And it's not until we start to view that body as a holistic system. It's not until we bring vitalism in to the understanding of that person's state of health or the things that they need or that they don't need that we see true health emerge. It is a challenging thing. So I think back to before I went to medical school and before I got my training through the Naturopathic Medicine Institute, just back when I consider myself not a health professional. And I was raised with a grandmother who used, I don't know if any of you will remember this company, there's called Shackley, and they had all these vitamins and minerals and cleaning products and all this stuff. And she had a garden and she grew a lot of her own food. And when something would happen to us, if we got hurt, we weren't feeling well, she had some kind of home remedy that she would use. So I was exposed to that at a pretty young age. Plus, my father is Cherokee, and there's a innate built-in wisdom, I think, that comes with having that native blood, that you understand that you have to make the body healthy again. You don't give it something to get rid of a symptom. So I didn't have the language to articulate that before I went to medical school, but I had a knowing. I had a knowing that if I didn't have what I needed, I wasn't going to be as well as I could be. And that was kind of a superficial understanding. When I went to medical school and I started to learn about all the different pieces and parts of the body, because even in naturopathic school, we had anatomy, which that looks at each individual part of the body, what's there, what do we know is there, the physiology, what's the function of different things in the body, pathology, what happens when a system goes bad and what do we call it. Like, we had all that stuff in the first couple of years of school. But by the time we got to clinical training, what happened is we brought all that together and paired that with this idea that the body is self-healing and that it needs certain things to self-heal. And that is really the beginning of my understanding of medicine in a completely different way. Not reductionistic, not taking things piece by piece. It's a holistic view. You might wonder, why don't I just call myself a holistic practitioner? And that's because it's more than holism. Vitalism is more than holism. Vitalism is a complex, it's simple on one hand, but complex on the other way of understanding how everything within me and outside of me works together to produce a certain level of health. And understanding how to manipulate or change or support those different components allows me and other folks who are vitalists, it allows us to change things just enough to kickstart that body's ability to self-heal itself. A couple of years ago, several years ago, I got a urinary tract infection and a kidney stone. And it was very painful. I was nauseous. I was worried I had appendicitis because of my abdomen was tender, all this stuff. So my husband and my best friend bring me into the emergency room, and they do all these tests and all this stuff, and they come back and they say to me, you have a kidney stone. Here's this bag of pills. Take these, and we'll follow up, with your doctor in a few days. Now, I was really out of it because I never take pain medications, hardly ever. And one of the first things they did was give me a shot of some pain medication. And so I was very out of it, very loopy, and my husband gave me a couple of doses of things that were in that bag, which made me feel even sicker. But the important point of me telling you this is that they did not tell me about the urinary tract infection. So I have this kidney stone, and it's a barbed kidney stone. It means it has little spiky things on the outside of it that as it travels through my urinary system, it was making cuts and slashes, which basically leads right into my blood supply. So I have this urinary tract infection, unknown at the time. This kidney stone is moving around, cutting and slashing things, and the probably E. coli, right, gets into my bloodstream, which is not supposed to happen, but it did. And within a few days of being sent home, I went into septic shock. I was in and out of consciousness. They rushed me back to the hospital where they admitted me and did IV antibiotics, really high strength. And when I became coherent enough to even have a conversation, I talked with one of my mentors. He prescribed a homeopathic remedy, which immediately affected my health in a positive way. And I was able to leave ICU, and within a couple of days, I adamantly demanded to be discharged because they just kept pumping me full of drugs. Now, it does not make sense to have a kidney stone and go septic. So all along, I was questioning them. What happened? Like, where did I get septic? Well, I requested a copy of my chart notes, not the chart notes, the shorthand chart notes, the full transcribed notes, which takes, about 30 days. Because I needed to understand how I went from having a kidney stone within a couple of days to being septic and almost dying. And I did almost die. It turns out that I had the kidney infection that nobody told me about. And I called the doctor and I said to her, you didn't tell me I had a urinary tract, not kidney infection, urinary tract infection. And she said, well, would it have mattered? You wouldn't have taken antibiotics anyway. And I said, you've got to be kidding me. There are hundreds of ways to treat a urinary tract infection. Antibiotics are only one of them. And of course, she scoffed at me. And let me tell you, as a side note, I have treated many, many, many urinary tract infections without antibiotics. It is very possible. And so I said to her, well, so the way I understand things is I had a urinary tract infection with a barbed kidney stone, and those bacteria entered my bloodstream, and that's how I went septic. And she said, well, that's one theory. And I said, well, I'm done talking to you now, because it's very clear to me what happened. You almost killed me. So why do I tell you this story? Because without the treatment of the septicemia that I had, I would have probably died, because does nature cure, does vitalism, do any of the modalities work that fast? Maybe, but it was Christmas. And I don't have a practitioner close to me, and my family doesn't know how to do the therapies, and I was not coherent enough to be able to tell them what to do for me. So they almost killed me, and yet they also saved my life. Now, I had months of issues after that hospital visit because of thrush, and they killed my digestive tract and all my flora. Like, I had a lot of rebuilding I had to do, not from the septicemia and not from the kidney stone, but because the treatments I got that quote unquote saved my life, which I'm grateful for. So why do I tell you that story? Because I believe there's a time and a place for many different kinds of medicine, for the allopathic approach, for functional, for lifestyle medicine, and for a vitalistic approach. right? Using nature cure. I believe there's a time and place for everything. But where we have really failed humans on this planet is by the order in which we apply those particular approaches. And Dr. Jared Zeff and several other folks, including people who had written years before them, there's this idea of a therapeutic order. And you can kind of think of a triangle, of a pyramid. And down here at the bottom, the widest part of this triangle is the restoration of proper function within the body. The restoration of all of these cornerstones, right? Where we make sure that we're taking in what we need and we're getting out the things that are poisoning us, where we don't even put those things in our body, where we're moving and sleeping and hydrating, and our bodies form, like you can think chiropractic, how our muscles and our bones are working together. Like all of that stuff should be addressed first. And then you move up the pyramid towards the very, very tippy top, and in between there might be supplements and other kinds of therapies and all sorts of things to the very tip, where we talk about this allopathic intervention, right? Of surgery or harsh drugs and things like that. And right now it's backwards. Until you walk away from that system, it's backwards, right? All of those very harsh, strong, not healing approaches are used first line. And this stuff about food or toxicity or reestablishing the vis, all right, balancing the vital force, all of that comes secondary if it's even acknowledged at all. And that's unfortunate for the human race. But I think a lot of folks are becoming aware of this. They're thinking about this. There's a lot more information around about it. More practitioners are getting alternative training and moving away from their allopathic roots to more holistic approach to health. Therapies like homeopathy and hydrotherapy and physical medicine, they really are being embraced much more than they have been in the last couple of 100 years. So I have hope that we can turn things around. But we need you, and we need me, and we need other practitioners to understand this concept. I'm going to wrap it up with this. Vitalism is the chemical and the physical properties of the body and how they work together. But more importantly is the energetic, the vital force, the vis. How healthy is that? And how we put everything in place to give the body what it needs and get out what's poisoning it and stimulate that vital force so that the healing power of nature can prevail and move us towards health, which is how we were designed. Thank you so much for joining me for this episode on vitalism. I'll talk to you next week. We're going to talk about how the body's innate intelligence supports health. How does it operate within the body, and how does it differ from the conscious mind and functions, and how do we recognize when it's working or not, and so much more. Hope you have a wonderful week, and I'll talk to you soon. Thanks for being on Vitalism with me, Dr. Eli Camp.